Penile atrophy is a huge issue for men who have had prostate cancer treatments and they don't really know what to do about it. So in today's video, we're going to talk about options for penile atrophy, like injections in Cialis and Viagra, and how to bring that up to your doctor. So we're interviewing Dr. Mark Scholes, who's a 30-year medical oncologist who focuses solely in prostate cancer, about the details of penile atrophy. So today we're talking about penile atrophy after prostate cancer treatments. Now there are various treatments, but penile atrophy seems to be associated with surgery and hormone therapy, and a couple of patients have wondered if it's related to radiation, which we can get into later. But can you define, how does the medical world define penile atrophy?
Well, it was reported many years ago after surgery, and studies were done because people were reporting shrinkage of their penises after surgery, and no one could really think of an anatomic reason. They're not operating on the penis, they're operating on the prostate gland. Such studies were done, and they confirmed that men's penises were shrinking after surgery. And I think we understand it now to be due to the shock period that follows after an operation. Men stop getting erections, those that recover erections, not everyone does, but let's say half of men recover some erections a period of months after the operation. And during that shock period where the men aren't getting erections, the muscles in the penis, just like any muscle, if you put your arm in a cast and take it out and you go, wow, where'd my arm go? Muscles in the penis can atrophy, and therefore there can be a shrinkage process that results from that.
Talking about surgery specifically, this is an issue that many men are dealing with, and they're kind of wondering, well, is there any coming back from that after it's already shrank? So is there anything that men can do to avoid this situation, specifically in surgery?
I don't know if there's any way to improve things once the damage is done. Possibly there is. But taking early preventative measures is like kind of a no-brainer. And studies have been done to induce erections in men after surgery, instead of just waiting for nature to slowly bounce back over a period of many months, to artificially induce erections soon after the operation. And unfortunately, this generally means learning how to give yourself an injection. Trimix can be a self-administered injection into the base of the penis and cause an erection. There doesn't have to be any interest in sexual activity. The nerves don't have to be intact. Men will get an erection if they're given an injection of Trimix. This is something practically all urologists know how to do. That sometimes doesn't get talked about because people are naturally reticent to take shots in such a sensitive area. But really, for men that are planning to do a radical prostatectomy and who want to try and maintain normal sexual function, the initiation of Trimix injections soon after the operation is a must.
Before I get to my next question, I wanted to let you know that this September we're having an in-person prostate cancer patients and caregivers conference here in Los Angeles, and we'd love to see you there. You can learn more at pcri.org. Also, if you would like to donate and join our cause, you can do so at pcri.org/donate. And please click that subscribe button, because when you do this, it helps us greatly in just getting our word out to the prostate cancer community on YouTube. Now back to my conversation with Dr. Scholes on penile atrophy. Since that is giving a shot to a sensitive part of the body, how do you learn to give that injection?
Right, so one of the concerns is giving the right amount, because stories abound about men that get too much of this and their erection doesn't go away and they're off to the emergency room, and having an erection for too long a period can be damaging. The right methodology is for men to get the first injection in the urologist's office by the urologist, who can start them on a safe dose and then slowly escalate with over time to the right amount so that the erections are lasting for the appropriate duration of time. So it's a medically supervised thing initially. Once a proper dose is achieved, then people can learn how to administer it themselves at home.
So in a talk by Dr. John Mulhall from our previous conference in September, he gave an extensive talk, which I'll link in the description below the video, but he talked about doing it 6 weeks after surgery. And do you agree with that? And is that the proper timeline to go to your urologist after surgery and say, hey, I would be interested in this?
Absolutely. I would probably start even sooner. I don't even see the rationale for waiting 6 weeks. There are a small minority of men who have rapid recovery of erections after surgery. It's not common, but it happens. And that can be augmented by Viagra and Cialis. So those individuals can sidestep this discussion that we're having and probably wouldn't benefit by self-administered injection therapy. But the vast majority of men that have operations on their prostate for radical prostatectomy are going to have this problem, and its recovery periods can go out to a year and a half. And to wait that extended period of time is going to create permanent problems.
When we talk about erectile dysfunction or penile atrophy, a lot of times patients don't understand that also is defined with Cialis and Viagra being in need when they're taking this. So when you're talking about penile atrophy and somebody who does have surgery, do they need to start taking Viagra and Cialis like right after the surgery? Are they taking it before? Like, what is that process like? And are they doing it on top of the injections versus you can just do the injection?
Since the pills are so much easier and generally well tolerated, it's very logical to initiate these medications immediately after surgery and see what kind of results you're getting. If erections are being restored, that's wonderful. Unfortunately, that's not a common scenario. Most men, they won't. There is a ability to use the medicines in conjunction with injections, but the injections tend to be so effective that you really don't need to have a pill to get further results. I think one unanswered question is what's an appropriate frequency if this is just being done for exercise. I mean, men can have intercourse, but they don't have to get the exercise to get the erection. And that would be probably a minimum of at least once a week, probably better twice or three times a week to ensure that you're getting the maximum exercise that is considered normal. Men frequently have erections at night when they're sleeping. I'm talking about normal men that haven't had surgery, and these are occurring in 3 or 4 times a night, every night of the week. This is the natural process of maintaining this ability in men is pretty much outlined with the daily sleep patterns and the frequency of erections. So to stipulate maybe once, twice, or 3 times a week for injection therapy, I mean, that would be the minimum.
A couple of times I've seen, does penile atrophy happen after radiation, not just surgery? So can you address that?
Well, I think one of the confusing things is that radiation therapy is often administered at the same time with hormone therapy. I think it's the hormone therapy that is the offender there, because when men take testosterone blockade, their natural nighttime erections disappear. And their libido also disappears. So it's not like they're pursuing sexual activity with Viagra or Cialis, which often can be effective in men on hormone therapy if people pursue it. But the low testosterone levels typically eradicate interest in sexual activity. That makes it very challenging to be thinking about counteracting the potential loss of nighttime erections, which hormone blockade causes, because there's no libido to stimulate this. People need to be informed that if you're going to be on hormone therapy for some period of time, 6 months, 18 months, that during that time, the low interest in sexual activity and the absence of nighttime erections that comes with hormone therapy can result in atrophy. And corrective measures need to be taken if one hopes to restore a normal romantic action after all the hormone treatment wears off. Being on a schedule to take some Viagra on a regular basis, or if the Viagra's not working, to motivate yourself to take a shot. If there's no scheduling of this sort of thing, it just sort of gets lost in the shuffle, and then people come to the end of their hormone therapy, they get their sex drive back, and they realize that they've developed atrophy.
So are there any other options besides Cialis and Viagra and penile injections?
Those are the most direct routes. There are other competing medications like Stendra, for example, but it's questionable whether the vacuum pumps are really accomplishing what we're talking about. These things draw blood into the penis, but they don't cause the muscular contraction that induces a normal erection, and therefore I'm not really convinced that it's compensating for the possibility of atrophy. Injections and or the pills is the methodology that we have to rely upon.
So as far as accessing, talking to your urologist, is this something where he's going to send you home with the shot? Do you go to a pharmacy and get it? And, what is that first kind of, I'm sure you've talked to, hundreds of patients who have done this. What type of feedback are you getting from patients?
I think one of the challenges, urologists are very busy and they get paid best to do operations. And so instructing people on how to give injections to correct penile atrophy is not high on the agenda of priorities for a urologist, especially in men who are already sort of apathetic. Perhaps they're on hormone treatment And they're not really interested in sexual activity, and they're certainly not interested in giving injections into sensitive areas of their body. So neither the doctors nor the patients are motivated. If it's related to post-surgery, the urologists don't like to talk about injection therapy in someone that's contemplating surgery. I mean, imagine how distasteful that would be in someone thinking, should I do radiation or surgery? And then the urologist, comes out with a dire warning saying, by the way, if you do surgery, you're going to have to give yourself injections in the penis 2 or 3 times a week until your erections come back. And that may take a year. How many people would still pick surgery when they could go with radiation? Of course, you could argue that the radiation patients, many of them are going to be getting hormone therapy, and they're confronting the same problem. But now with PSMA PET scans, there are more and more options to do radiation without doing hormone therapy.
From what I've read, it seems like men are having, half an inch according to the studies, and it can be even more, and in girth-wise, it can be different too. But I think that there's a huge concern as couples, who want to participate in sexual activity, the man is obviously concerned about that. But then the idea of bringing in an injection into it, that's also kind of it's already an intimate situation, but then you're bringing kind of a partner situation into it as well. So how does a man, kind of do this before and then go into the bedroom and just be ready for having an intimate moment with their partner? And how long do they need to do it before they go into that activity?
Yeah, the way it's been described to me is that these shots actually work very quickly, and the needle is very tiny. Many men say things start to get amorous. They just excuse themselves very briefly, go in the bathroom, give themselves a shot, and it will induce an erection within just a couple minutes. And these erections are dose dependent, so they can last 30, 60 or more minutes. Then they'll just disappear spontaneously. So for people to get practiced at this, they can give themselves a shot in 10 seconds. I mean, it's a very quick, easy thing to do. There's definitely a barrier to overcome in terms of the idea of putting needles in such a sensitive area of our bodies. But once they become a little more practiced, a lot of my patients swear by them and are very grateful for this.
Oftentimes, I talk to men who have no idea that there are options for things like penile atrophy, and they are not speaking up for themselves. You'll just be in the middle of a conversation with them, and they'll be talking about their prostate cancer and their issues, and it comes around, and it's not even a question that they've even talked to their urologist about, not even an issue. And this is important. I don't want men to suffer in silence. If there are options like Viagra or Cialis or penile injections, you should know about it. So please, advocate for yourself. If you have questions or concerns, or maybe there's just a part of the side effects of treatment that you're not comfortable with, talk to your doctor about them and see if there's a way to mitigate the side effects and really give you the options. And another great way to get the education you need in a urology office is a lot of time the nursing staff is very experienced, and it may take a second to go, well, I don't know if I want to ask a nurse about this or not, but they're willing to take the time and sit down with you oftentimes. Highly educated nurses that are experienced in urology offices are a great resource for prostate cancer patients, and they can give you a lot of information on the details of what you need to know with that prescription, and where you go to the pharmacy and how you talk to them and where the injection goes. It's just a secondary method of education that I really think is important. Our nurses do an incredible job taking care of our patients, and I just think it's such a really great resource. So please take advantage of it. And also, maybe you're shy. Maybe you don't want to talk to your urologist. It's uncomfortable for you. I would bring somebody else in. I would tell them what your concerns are. If you do have a trusted friend or partner that you can talk to, ask them to help you advocate for yourself. Because oftentimes what I see is that men don't talk about penile atrophy, and then they're embarrassed, and then all sorts of mental and emotional side effects occur with these treatments that don't necessarily have to be there. I'm not saying they don't exist and some of them aren't permanent, but there are options for a lot of times, and it's important to search out and see if those options are available to you. Because if you just don't have to live with some idea that maybe your sexuality has been affected, and there is help for it, advocating for yourself and empowering yourself with research and your options is incredibly important and can be a really great answer to that. Now, if you need help advocating for yourself, if you don't know the questions to ask, or maybe you just want to get kind of some background information from other people who've experienced things like this, you can contact our helpline at pcri.org/helpline. These are prostate cancer patients who have been through different treatments, and they know a lot about what you're going to talk about, and they can share their experiences with you. And this is just a really great way to build up your knowledge and just get ready for your medical appointments and make sure that you're coming out with a shared decision-making experience, that you feel like your medical team's on your side, side, you're getting your questions answered, and you're not living with some sense of ambiguity. The more questions, the more research, the more you're empowered to make decisions that are right for your particular health, and that is extremely important. Thank you so much for watching our videos, and please remember, most of all, you're not alone.